Hello, everyone. This is Yoko. I aim to continue delivering videos as much as possible this year. In this channel, I share information in English about events happening in China that may not be widely covered in other countries. Since I gather information from various media sources, I would be happy to receive your opinions and comments about the content of the videos. If you enjoy the content, please consider subscribing to the channel and showing your support. During the year-end and New Year holidays in Japan, hospitals are closed, so I'm taking extra care of my health. Today, I'll talk about health-related medical insurance. Let me explain about medical insurance in China. There are mainly two major insurances, Urban Employee Medical Insurance and the new Rural Cooperative Medical Scheme. It's reported that these two systems cover approximately 90% of China's population. In rural areas, many people might think that they are not enrolled in medical insurance. However, the reality is that almost everyone is covered. As mentioned earlier, this insurance is based on a system similar to Japan's, where urban workers subscribe to urban employee medical insurance, and employers bear the insurance premiums. This means that the premiums are deducted before employees receive their salaries. However, with the rise of gig economy workers, such as food delivery drivers, who are not employed by companies but work as individual contractors, the situation is changing. These individuals, who were not previously eligible for urban employee medical insurance, now have the option to subscribe and pay the insurance premiums themselves. To broadly understand China's medical insurance, you can think of urban workers as having urban employee medical insurance funded by their employers. Specifically, employees of companies and government officials typically subscribe to employee medical insurance. On the other hand, the new Rural Cooperative Medical Scheme includes individuals in rural areas engaged in agriculture, who are not covered by urban employee medical insurance. The main difference between these two types lies in the coverage rate. Urban employee medical insurance targets individuals working in urban areas and generally provides a higher coverage rate than the new Rural Cooperative Medical Scheme. Therefore, those enrolled in urban employee medical insurance tend to have lower out-of-pocket expenses when visiting hospitals. An interesting development that has garnered attention this year is the significant decrease in the number of people enrolled in the new Rural Cooperative Medical Scheme, as mentioned earlier. Approximately 25 million people are reported to have withdrawn within a year, raising concerns. The reasons for this decline vary, with some individuals switching from rural to urban systems due to education or employment-related moves. However, a substantial number of people have voluntarily stopped paying insurance premiums. One of the main reasons for this decline is the substantial increase in insurance premiums. Over the past 20 years from 2003 to 2023, premiums have increased 37 times, rising at an annual rate of about 19.718%. The annual premium in 2023 is approximately 380 yuan, equivalent to around 7,000 to 8,000 Japanese yen. While this may seem manageable on a household basis, it becomes a significant burden on an individual level in China's rural areas. This issue of rising insurance premiums highlights challenges within China's healthcare insurance system. Now, let's consider a rural couple working in the countryside, along with their parents and one child. In this scenario, there are approximately 5 family members. This means a monthly burden of around 40,000 yen. This is a considerable amount, and it might be challenging to afford even for those who want to make the payment. As a second reason, those paying insurance premiums are essentially individuals currently in the workforce. Without income, they cannot afford to pay. People in the current working generation may not feel the necessity of health insurance much, especially if they are currently healthy and don't frequently visit hospitals. However, as mentioned earlier, the burden is significant. Entering insurance may not be very helpful when someone falls ill. In the case of basic health insurance, the coverage is limited, leading to substantial out-of-pocket expenses. This means that even if someone has insurance, the out-of-pocket costs may be so high that they can't afford hospitalization. For people in rural areas, paying a high amount every month but finding the insurance not very useful in times of need makes them reluctant to continue paying. In China, people are aware of this situation, leading to a decline in enthusiasm for participating in the new Rural Cooperative Medical Scheme. Even government officials involved in promoting this system in rural areas feel that the system lacks rationality. Ultimately, even if enrolled in insurance, it might not be useful in times of need, leading to reluctance to continue paying. People involved in grassroots efforts to promote health insurance in local areas are expressing concerns. They point out that if the current system continues, more and more people will stop paying insurance premiums. The issue lies in the fact that the system, though labeled as insurance, is not truly insurance. Insurance, fundamentally, is a system where a large group of people covers a risk that an individual cannot bear on their own. However, the current system covers even minor injuries or illnesses that an individual can manage within their income range, which is not the original concept of insurance. In the case of genuine insurance, it would cover significant risks that an individual couldn't handle alone, such as a major surgery costing around 1 million yen. It's uncertain who might face such risks and when, so everyone pays into the insurance pool. In reality, the current health insurance systems in Japan and China, despite being called insurance, cover even the portions that individuals can manage on their own, and with everyone relying on it, the funds may not be sufficient. The fundamental idea of insurance, where those taking greater risks pay more and those actively taking measures to stay healthy pay less, is not fully realized in the current systems. Instead, the systems resemble more of a welfare policy. This viewpoint is shared by some viewers who provide short comments, stating that what is referred to as insurance is not really insurance. This sentiment echoes the concerns mentioned earlier, and this issue is prevalent not only in China but also in Japan. The introduced health insurance systems are, in essence, more like renamed taxes, and without such systems, the financial burden on individuals would likely be much lower, although there's no straightforward solution. Continuing the current state as it is seems quite precarious. It is anticipated that in the future, the prices of medications will rise, and the existing methods may become inapplicable. With the continuous emergence of expensive treatments, the existing approaches might become increasingly challenging. This implies the possibility of a significantly high burden on those paying insurance premiums. Simultaneously, even if the Japanese become wealthier, the general income of the average person may not increase significantly. In the end, forcibly collected funds, whether labeled as insurance premiums or taxes, will be deducted, leaving a small amount in hand. This could lead to a decline in the standard of living. In my opinion, those currently in the workforce might face genuine difficulties if the system is not made more rational. I believe that, at the very least, people who voluntarily increase their risks, such as those involved in illegal drug activities or engaging in risky behaviors, should not be treated the same as ordinary individuals. It is peculiar that those who actively maintain good health, ultimately contributing to lower insurance burdens, are not appropriately rewarded through the current system's design. Furthermore, looking beyond medical insurance, focusing solely on healthcare won't solve the problem. In essence, the money flowing into healthcare is leaking out of the country. In the context of healthcare expenditures, Japan is a trade deficit country. Reversing this trend is crucial. Japan, with its high research standards and technological capabilities, has the potential to become a trade surplus country in the field of healthcare. This shift is not about cultural differences but rather about utilizing research effectively for drug development, a concept that has evolved in both the United States and Japan. In the past, the disconnect between university research and drug development was an issue in both countries. However, the United States has since improved its collaboration, with universities playing a more active role in contributing to new drug developments. Japan, too, can adapt and better utilize research results to bring about positive changes. Instead of attributing difficulties to cultural differences, exploring successful models and incorporating innovative Japanese approaches could unlock the country's potential. This concludes our discussion for today. Until next time, take care.